So today we are meeting with Bob, who is a new patient. I have not seen him as a patient before, and he has been diagnosed with Myasthenia Gravis. And can you explain what happens with Myasthenia Gravis?
Yes, it was discovered by a neurologist that I went to after experiencing some dysarthria or slurring of speech, and it came out of the blue. I was about 68 years old, I think, when I noticed it. Recorded myself because I had no idea what I was going, a minor stroke or whatever. Played the recording back for my neurologist. She had a lot of ideas, did a blood test, and discovered that I have MG, or Myasthenia Gravis. So that was about 3 years ago, and she took a pretty aggressive approach to treating it, and so that's where I am today.
And so what kind of effects does Myasthenia Gravis have generally on the body?
On the body, I get highly fatigued. When the infusions that I'm currently on wear off, my articulation suffers. I'm sometimes barely able to speak.
When the infusions wear off, your speech is affected.
Speech is affected, yes. Like I say, I'm highly fatigued. I get dizzy. I'm not able to rise out of a chair without using my arms. It's a pretty individualized disease, as I understand. Mm-hmm. It affects various patients in various ways.
Have you noticed that it causes anything like numbness in your feet, or?
I haven't really noticed that.
Okay.
It's difficult now for me to trim my own toenails. That's pretty much why I'm here. But it's a it affects almost all of your daily life. Sometimes you will your feet will hurt. You'll start to walk flat-footed. Your balance is way off.
Okay, so balance becomes an issue.
Balance becomes an issue, yes. Okay. Yeah.
Well, thank you for informing us all.
Yeah, absolutely.
About that, because it's not a disease that gets a lot of attention.
No, it's very rare, but I think maybe undiagnosed or misdiagnosed some of the time. So.
Yeah. Okay. So, just to clarify one of the things that you said, the reason that you find it difficult to trim your nails now is what?
Well, is the fatigue that comes along with MG. The MG, of course, affects your body's ability, nerves to communicate with muscles, and when you want to do something, and your muscle won't allow you to do that, that's what happens here, so.
So the holding of the nail clippers or
The
the
holding-
bending over?
Yes, bending over, trying to bend my knee up to,
Okay.
that's the difficulty here, so. Yeah.
Now I know when you trim these, you probably don't trim this down so far.
I kind of do,
You do?
because,
Okay.
yeah, it actually,
Don't-
it kind of catches on my socks, so.
Okay, so I'll smooth this out
Okay.
and thin
great.
it out a little bit.
Yeah. Trying to prevent some ingrown toenail.
Okay, well that toenail feels pretty good.
Yeah. Now this, is there like on the side here, is that?
You're showing me this right here?
That one there, yeah. Can you cut that back a
You want me
little?
to, yeah, I
Yeah.
can trim it back a little further.
Sure, yeah, I know that gets caught on my sock when that grows out, so.
Okay, yeah.
That'd be great.
So we can keep it trimmed back on an angle, because
Yes.
over here, I can make sure I'm not leaving any little spikes or,
Yeah, that'd be great.
okay. Does that just feel okay now?
That feels good, yes.
All right, so
Yeah.
the goal is if we can get you in here every 2 to 3 months, then we can prevent that nail from, from getting ingrown
Uh-huh,
or getting too thick. Now,
sure.
I'll have to look and see if the Myasthenia Gravis diagnosis will get this covered for you.
Mm-hmm.
But if it doesn't, you also have your pulses up on top here are not great.
Okay.
So that's how we'll get this covered, by decreased pulses.
Oh, okay.
Okay.
Okey-doke.
MG may be a diagnosis Medicare will cover this for. I don't know. I'll have to go look.
Mm-hmm.
But
Okey-doke.
all right. Well, thank you for letting us do the video.
Yeah,
and thank you for
absolutely. Yeah.
educating.
Yeah, thank you for attention here, Doctor.
You're very welcome.